Have you ever noticed itchy red welts suddenly appearing on your skin only to disappear just as mysteriously? If so, you might have experienced urticaria, more commonly known as hives. This condition can be frustrating, uncomfortable, and even distressing when it becomes a recurring problem. Urticaria is one of the most common skin conditions, affecting millions of people worldwide at some point in their lives. But what exactly causes urticaria? Is it always due to an allergy, or can there be other triggers? How do doctors diagnose it, and more importantly, how can you manage it effectively? In today's video, we're going to answer these questions and take a closer look at urticaria, covering its different types, causes, diagnostic process, and treatment options. Whether you or someone you know has struggled with hives, this information will help you understand what's happening in your body and help you take control of the condition. Hi, I'm Dr. Knapp, family medicine physician, here to bring you medical information so you can take control of your health and make the most of your doctor visits. Let's get started. Urticaria occurs when the body releases histamine and other inflammatory chemicals from mast cells, which are specialized immune cells in the skin. This release leads to leakage of fluid from small blood vessels, causing swelling, redness, and intense itching. These welts, or hives, can appear anywhere on the body, including the face, arms, legs, and torso. They can range in size from tiny dots to large, irregularly shaped patches, and they may even merge to form larger areas of swelling. One of the most frustrating aspects of urticaria is its unpredictable nature. The welts may last only a few hours before disappearing, only to reappear elsewhere on the body. Some people experience a single episode, while others deal with recurring outbreaks. In some cases, urticaria can persist for months or even years, making it a chronic condition that significantly impacts quality of life. Since urticaria isn't a disease itself, but rather a symptom of an underlying issue, it's essential to understand its different types and potential triggers to determine the best course of management. Urticaria is broadly classified into two main categories: acute urticaria and chronic urticaria. Acute urticaria is the most common form and lasts for less than 6 weeks. It often occurs suddenly in response to a specific trigger, such as an allergic reaction to food, medication, or insect stings. Infections, including the common cold, flu, or bacterial infections, can also lead to acute urticaria, especially in children. The good news is that acute urticaria usually resolves on its own, sometimes within a matter of hours or days, without long-term consequences. Chronic urticaria, on the other hand, lasts longer than 6 weeks and can persist for months or even years. Unlike acute urticaria, chronic cases are often not linked to allergies. Instead, they may be related to immune conditions, persistent infections, or unknown factors. For many people with chronic urticaria, the cause remains unclear, which can be frustrating and make treatment more challenging. Beyond these two main categories, there are specific types of urticaria triggered by physical or environmental factors. Dermatographic urticaria occurs when the skin is scratched or pressed, leading to raised welts that follow the lines of the pressure applied. Cold urticaria is triggered by exposure to cold temperatures, such as cold air, water, or even holding an icy drink. Heat or cholinergic urticaria develops when the body overheats due to exercise, hot showers, or emotional stress. Solar urticaria is a rare form triggered by exposure to sunlight, while aquagenic urticaria, another rare condition, occurs when the skin comes into contact with water at any temperature. Each of these forms of urticaria has unique characteristics and different management approaches. The causes of urticaria vary widely, and in many cases the immune system plays a central role. Often the immune system mistakenly identifies a harmless substance as a threat and releases histamine, triggering an allergic reaction. Some of the most common allergic triggers include foods such as nuts, shellfish, eggs, and dairy, as well as medications like antibiotics, aspirin, and nonsteroidal anti-inflammatory drugs. Infections are another frequent cause, particularly in cases of acute urticaria. Viral and bacterial infections, including respiratory illnesses, urinary tract infections, and even COVID-19, have been known to trigger outbreaks of hives. Some people develop chronic urticaria due to an underlying autoimmune condition, such as Hashimoto's thyroiditis or lupus, where the immune system mistakenly attacks the body's own tissues. Emotional stress can also contribute to urticaria. Anxiety, tension, and strong emotions may worsen hives, particularly in individuals who already have a predisposition to the condition. Environmental factors like extreme temperatures, prolonged pressure on the skin, exposure to water, and even exercise can serve as triggers in certain individuals. Despite thorough medical evaluations, many cases of chronic urticaria remain unexplained. This is known as idiopathic urticaria, meaning it occurs without a clearly identifiable cause. While this can be frustrating, it does not mean the condition is untreatable. Diagnosing urticaria typically begins with a detailed medical history and physical examination. Your doctor will ask about when the hives started, how long they last, and whether any specific triggers seem to be involved. In cases of acute urticaria, further testing is often unnecessary because the cause is usually evident, such as a recent infection or a known allergic reaction. For chronic urticaria or cases with unclear triggers, additional testing may be recommended. Allergy testing, including skin prick tests or blood tests, can help determine if an allergen is responsible. Blood tests may also be ordered to check for underlying autoimmune conditions, infections, or thyroid disorders. In some cases, physical challenge tests are performed to assess whether environmental factors such as heat, cold, or pressure are triggering the hives. Even with testing, many cases of chronic urticaria remain without a clear cause. However, effective treatments are available to help control symptoms and improve quality of life. The treatment of urticaria depends on its severity and underlying cause. For mild cases, avoiding known triggers and using over-the-counter antihistamines is often enough to relieve symptoms. Antihistamines work by blocking the action of histamine, reducing itching and swelling. For chronic or severe cases, doctors may recommend daily non-drowsy antihistamines such as cetirizine or loratadine. If symptoms persist, stronger antihistamines like hydroxyzine or diphenhydramine may be used, though these can cause drowsiness. Some patients benefit from leukotriene receptor antagonists such as montelukast, which help reduce inflammation. In severe cases, short-term corticosteroid treatment may be used, though long-term use is avoided due to side effects. Biologic medications like omalizumab may be considered for chronic urticaria that does not respond to standard treatments. I just want to take a moment to ask that you hit that like button and subscribe to my channel. Leave a comment below if you have any topics or questions you want covered in future videos. Anyway, lifestyle modifications also play a crucial role in managing urticaria. Keeping a symptom diary can help identify triggers, while using cool compresses, wearing loose clothing, and managing stress through relaxation techniques can reduce flare-ups. Urticaria can be unpredictable and frustrating, but understanding its causes, triggers, and treatment options can make a significant difference in managing the condition. Whether your hives are occasional or chronic, working with a healthcare provider to identify the best approach for relief is essential. While urticaria may not always have a clear cause, effective treatments are available to help control symptoms and improve quality of life. Thank you for watching. As always, take care of yourself and make the most of your day.